We needed that heart. We were desperate for that heart. Reed was born at Conway Regionals on April 5th. He was born into the world perfectly healthy. We were able to go home the following day, but then 2 days later we were readmitted for his jaundice levels. And he eventually overcame that, and then we were able to go back home on a Wednesday. And then starting that following Saturday, he started acting not right. Just something was off, and we knew immediately we needed to take him to get him checked out. And on the car ride from home to the Arkansas Children's ER, he just started crashing. And I ran him into the ER and was greeted by the receptionist, and the way she responded to the nurse, to the trauma team, I mean, everybody just worked as a team and got right on Reed. They were just trying to figure out what was going on, but he was already in heart, kidney, liver failure. They immediately placed him on ECMO life support, and for 6 days we had a roller coaster of a ride, but he eventually became strong enough to come off of ECMO life support.
So Reed was born with actually a normal heart, and when he was about a week old, he developed a viral illness which unfortunately affected his heart. And was presented to an outside hospital where he had cardiac arrest. He initially was transferred here and placed on life support for about 1 week, and though he was able to get weaned off of that, his heart function never recovered. He held his own for about 3 months and then began to get sicker, and when his clinical status became such that his native heart could not support him, he was hospitalized in July of this last year. He was then placed on the transplant list and had to wait.
We love Dr. Kinnett. He's really wonderful at being able to explain your child's condition. He takes the time to really talk with you about it, to make sure you fully understand, and prepares you for it. I mean, before we knew for a fact Reed was going to need the transplant, he was talking with us previously about it just so we were well prepared for if it did take that route, which it did. So we were able to really prepare ourselves for that. Houston was a wonderful option to go to because our program was inactive. However, we knew it was going to be different. We just didn't realize how different it was going to be. Arkansas Children's, they do a wonderful job at not only taking care of the patient's needs, but the family's needs also. Houston, we had to stay in hotels a lot. I slept in an ICU chair whenever I was down there by myself. My husband, he had to continue to work, and so we were living with our family divided. We moved to Houston for a short period of time and bought a camper and lived in a camper and just made it work. The team there was wonderful, but having our family divided and not having the family support here was it was hard. While we were in Houston, Hurricane Harvey hit. We were flooded into the med center, so there was no leaving the hospital. So I was isolated down there by myself for 10 days before my husband and our other child was able to make it through to us because of all the road closings. And in return, the transplant became inactive. One thing I really appreciate about Arkansas Children's is even though we were no longer their patients or in their care, they still kept up with us. They did not forget about us. And the minute that they became active again, we knew. And I think I jumped with joy whenever I got a text message saying that we were back active and asked if we wanted to go home. I remember just crying and saying, "We get to go home, we get to go home."
Arkansas Children started heart transplants in 1990. So nearly 30 years ago. And over that time period, we have done 350 individual heart transplants. That is one of the greatest numbers in the country. We have received patients referred to us for heart transplants from states as far away as Oregon, as well as ones closer such as Louisiana, Oklahoma, Kentucky, Mississippi, and Tennessee.
Reed has been listed here in Arkansas for about 50 days. So on Sunday evening, Reed started labor breathing, and immediately that's a red flag for a heart failure baby. We knew he was going to need to be intubated, but because he was so severe, they didn't want to move him to the ICU. It was just, let's keep him calm, let's keep him happy, do not let him get upset. The fear that overcame us, along with the peace of mind knowing that everyone was going to make the right call for Reed, that just made it so easy for us to give him our baby. Intubating a heart failure baby is not an easy task, and that alone could have been it for him. And that evening, on November 20th, Dr. Garcia walks into our room, and she looks at my husband, she goes, "Where's Mom?" And I turned around where she could see me, and she goes, "We got the call, we got the call." And I just remember going to his bedside and I was like, Reed, we got you a heart. And then the words just flooded out of me, you're gonna get to grow up. That night was the first time in 8 months that I felt like I could finally take a deep breath. I knew we're okay, we're gonna be okay. Everyone was flooding in, all the doctors, all the nurses, all night long. We couldn't sleep. It was a celebration. Dr. Reemtsen was very confident, in which that helped ease our fears, which we were overly confident in him, and along with our team of doctors that were going to be taking care of Reed after transplant. So honestly, we had no worries. We were just ready.
With Dr. Reemtsen joining our team, he's not only provided exceptional surgical leadership, but a vast array of experience. His previous institution in California, he was combined with an adult and pediatric. To do a heart transplant does require a lot of surgical skill. It's a very complex surgery, especially in someone with congenital heart disease, or even a heart which is sick, such as with Reed, where its size is out of proportion. So Dr. Reemtsen's surgical expertise, his surgical outcomes, his techniques, as well as his experience, has all added tremendously to our ability to care for these patients.
Reed is very common when it comes to small children getting transplants. Well, especially with transplant, we go through all the benefits and the risks, and always the benefits far outweigh the risks. With transplant, it's unique though, because they are actually trading one condition for another condition, the condition now of transplant, because they have lifelong medications and a follow-up with their doctors. Transplant is a real lifestyle, not only for these babies, but also for their families. And so it's really preparing them for the responsibility of being a caretaker for these children after they have their heart transplant.
Reed came back from his transplant surgery already a new child. His color was better. He was immediately trying to kick his legs, and he just felt already 100% better. It was mind-blowing. November 20th is also really important for us because that was the day 8 years ago that my husband asked me to marry him. So now we'll remember that day as we got Reed a heart, and that was the day I said yes.
Arkansas Children's has a very storied and excellent reputation throughout the country. We're going to continue that with excellent results like we've seen with Reed, be the leader in ventricular assist device and transplanting adults with adult congenital heart disease. We don't only want to be the best in the state, obviously, but the best in the country.
Arkansas Children's Hospital, and especially the CV unit, it is the diamond in the center of the natural state. We are so fortunate to have such a wonderful staff that this is their calling. They're here to help us. You know they're there to support you. They're going to help lead you through them, and they're going to listen to you. They're going to hear your concerns, they're going to hear your fears, and they're going to acknowledge it. To be able to hand your child over and know you're going to get the best care is priceless. Home is where the heart is, especially for Reed.